Hi everybody, I'm Dr. Richard DeCenso, also known to my patients as Dr. D. Today we're going to be talking a little bit about a symptom called diabetes or high blood sugar. Now, it's commonly accepted that if you go to your doctors and you have a conventional evaluation performed, you're going to be diagnosed with one of a variety of symptoms that may in fact not in and of themselves be an actual disease or a disorder, but simply the result of other mechanisms that have come into play over a period of time that cause or contribute to the symptom of things like hypertension, diabetes, IBS, insomnia, stress. And so when talking about diabetes specifically, obviously we're talking about regulating and maintaining a normal blood sugar level. But once again, as with any other disorder, any other label, any other disease, a question has to be answered before we can provide an adequate solution or an accurate solution. And that question is, why? Why do I have high blood sugar? I'm very conscious of the carbs that I eat. I exercise regularly. I take all the right supplements. I sleep well. I'm doing everything that everybody's told me that I should be doing. And yet, all of a sudden, out of this vacuum emerges a diagnosis of high blood sugar or diabetes. Now, of course, there are a couple of different kinds of diabetes. One of them is type 1, which has more of a genetic basis than the type 2, even though they both have a genetic component. And in type 1, it's simply the fact that the pancreas is not producing enough insulin. And it becomes a little more difficult to manage in terms of answering the question, why is the pancreas not producing enough insulin? And one of the possibilities, just to give you a flavor for what we might be dealing with here, is the fact that there is a gland, actually two of them, called the adrenal glands, which are like two little jellyfish glands that sit on top of your kidneys, and they have a variety of functions to perform. Number one, their primary job is to monitor the environment, the external environment, the biological environment, for what are called perceived threats. Meaning that, is there something out there that I need to be aware of that could possibly contribute to or lead to the development of an actual diagnosable disease? Now, in looking at the possibilities for what these perceived threats might be, it can be something as simple as a biological dysfunction, a problem with digestion, a problem with sleep, a problem with hormone production, a problem with carbohydrate metabolism, a problem with any aspect of digestion that may contribute ultimately to an imbalance in the blood sugar. But in addition to monitoring the environment for perceived threats, the adrenals also have other jobs to perform. They are responsible for regulating blood pressure. They're responsible for regulating blood sugar. They're responsible for producing male and female hormones, and they're responsible for producing insulin. So if the adrenal glands are in any way, shape, or form involved in this process of allowing blood sugar to become elevated, once again, you have to ask the question why, and you have to look at all of these other possibilities. Otherwise, you're simply being treated for a symptom, which is elevated blood sugar, which is exactly what we don't want to do. So at Matrix Transformation, we turn symptoms into solutions by looking at things that nobody else is looking at in ways that nobody else is looking at them, which in fact is the foundation for the entire process of evaluating the human matrix, which contains all of these elements of stress, of environment, of the genetics, as well as feelings of not feeling as though we have control, a sense of lack of predictability in our day-to-day lives, a lack of a shoulder to cry on, or at least someone who appears to or pretends to listen to you, and an outlet for the frustration that builds as part of the adult stress model. So you can see the role that stress potentially plays in this potential for blood sugar to be abnormal. You can see the role that nutrients might play in the sense that I don't have enough raw materials for the adrenals to function normally, therefore I have to sacrifice some of the functions that I have, and in doing so I have to recruit the functions of other systems in the body, thereby causing a compromise in these systems. For instance, one of the first hormones secreted by the adrenal glands in response to the perceived threat is to recruit the thyroid gland via the pituitary gland as a resource for supporting the normal function of the adrenal glands. And now, not only have you been diagnosed with high blood sugar, but you've been diagnosed with a compromised thyroid function. So you can see that any disorder, any disease, any diagnosis is the net result of a series of events that occurs in terms of imbalances, deficiencies, dysfunctions, and compromises in the biological environment that need to be investigated in order to answer that most important question, why?